response. After chemotherapy, you do x-rays, CAT scan, the cancer is gone, and that's good news. Unfortunately, it come back later, but I'm not talking about it for now. After those patients undergo chemotherapy treatment and you do CAT scans, everything is gone, we call it complete responders. Those patients, we give them brain radiation. Why is that? Because chemotherapy, unfortunately, does not go to the brain. Chemotherapy used for small cell lung cancer does not treat the brain effectively. So those patients who are limited stage disease or early disease, when they finish the chemotherapy, they are staged, meaning we do CAT scan to make sure the cancer is gone. And if the cancer is gone, then yes, those patients need to have brain irradiation or X-ray treatment to the brain. Why is that? Because chemotherapy does not go to the brain or does not treat the brain effectively. After patients receive brain irradiation, they are monitored and watched. Cancer come back in a significant number of those patients over the months and years. And many of those patients, unfortunately, they get what we call it second primary or second cancer. They get cancer of the aerodigestive tract different from their original cancer because they are long-term smoker and drinker. And you could see a second cancer coming. And that's why initial report would say 5% for lung cancer, but because of the second primary tumor come and unfortunately many of those patients do not make it. It was 2%, 5-year survival. Some data will tell you for limited cancer, limited stage cancer or early small cell lung cancer, 20% 2-year survival, but again many of those patients will get second primary tumor. And because the effect of smoking is still ongoing, so the transformation of normal cell to pre-malignant cell to pre-cancerous cell, then cancerous cell is ongoing because of the effect of the carcinogenic effect of smoking on those cells. So when patient get one cancer, that does not mean that's it. No, they get second cancer, unfortunately. So stop smoking is the answer. Also, those patients who diagnosed with cancer, when they go for treatment, especially radiation treatment, they must stop smoking. Because when you smoke, the oxygen in the blood is low. Radiation to work better, we need more oxygen in the blood. So if you stop smoking, there will be more oxygen in the blood. So the effectiveness of radiation, meaning the effectiveness of killing the cancer, is high. And numerous studies show that in lung cancer, head and neck cancers, and other cancers, the oxygenation is very important. Even for cancer of the cervix, female cervix, if the hemoglobin low, the control of cancer is less than if the hemoglobin is normal. They did numerous studies. When the hemoglobin less than 10 for patients with cancer of the cervix during radiation treatment, the outcome is much less than if the hemoglobin above 10. So in many sites, the oxygenation, when you have more hemoglobin, you have more oxygen and many other variables as well. In case of lung cancer, head and neck cancer, oxygenation of the blood is very important. When you smoke, the blood will have less oxygen and the radiation will work less. So it is a must for you to stop smoking completely during the course of radiation treatment. So what about those patients who already got treatment for their cancer completely gone, and they got their brain irradiated? Then those patients need to be followed up to recognize if they get second cancer or recurrence of their cancer, because big number of them will get second cancer or recurrence of their cancer. So it's so important to periodically seen by their oncologist and by their primary care physician. Symptoms of cancer of the lung: cough, dry cough or coughing purulent material or coughing blood, losing weight, shortness of breath, pain, and symptoms related to spread of cancer itself, which could be, if the spread to the brain, will be neurological symptoms, could be numerous neurological symptoms from double vision, severe headaches. Again, those symptoms not necessarily mean cancer, and that's a very important point. I do not want every patient with cancer to panic when they get any symptoms, because many times, as a matter of fact, the majority of times is not related to cancer. It's related to either infection or stress or trauma or any other cause. Usually is not cancer. Inflammatory disease, like a patient might start to experience arthritis, and she or he already have arthritis, but at the time treated with cancer, the pain, arthritis pain sometimes increase and decrease, and the pain is significant. She or he thinks the cancer in the bone, and I see a lot of patients like that. So we investigate the bone, we do bone scan, we do MRI, we put the patient in significant medications. Then we found that the patient have arthritis, and with simple non-steroidal anti-inflammatory medications, the pain completely gone, and you could see clearly the arthritis picture in the screen. So you as a patient need to have good lifestyle. You do not need to panic, because there is no reason to panic. Every individual, whether they have cancer or no cancer, they get symptoms from cold, from stress, from twisting their legs during exercise, from not eating right, and so on. So these symptoms happen every day. So do not panic, because many times they are not related to cancer. But we wanted you to be a little bit alert, to recognize any new symptom and report it to your doctor. That basically, but you do not need to panic. Because I see a lot of patients keep panicking for no good reason. No. And believe it or not, you could have the most advanced cancer, and many of you, my patients, hear me because they know this is truth, and they are long-term survival. We don't know the future. Only God knows the future. Even you see odds. Oh, the odds, I would not make it. No, that's not true, because every patient is different, and there are many variables. your immunity, your strength, your age,